So you've decided to get an implant. Let's talk about some things that you can do to get ready for that. Hi, my name is Jeffrey Butts and I'm a doctor of dental surgery, and this channel is all about health and wellness for you to be healthy and wealthy. All I want to do is help you optimize your health journey. Today, we are talking about what you should do once you've decided to get a dental implant. And this is for everyone across the globe, okay? So, couple things. First of all, that's a great choice for you, and you do need to make sure that your chew or your bite is even on both sides, so you have the options of where you can put your food. Getting a dental implant is the best way that we have come up with to replace missing teeth, all right? So good choice. So what can you do? Guys, I always say, know what your blood type is. You know what your blood type is so you can at least decide the foods that you should and shouldn't eat. And this is actually days before the procedure. All you wanna do is get yourself ready for the procedure. So, knowing your blood type, then you would take your list that you can get from my website, campcreekdental.com. It's a free list. You just go to blood types and then you download the blood type that you are. And for the most part, you avoid what it says to avoid and you eat the things that resonate with you that it says to eat. Now, for my vegan friends, and you're an O blood type, okay, it makes it a little bit more challenging to you because you do want to get your proteins in order for your body to build what it needs to build for you to grow bone around the implant. Now, what happens when you get an implant? All right, so there is a drill. The drill goes beyond the tissue and it goes into the bone, right? And then an implant is placed in the bone. There are two cells that work for us to make sure that that implant becomes tighter than when the implant was first placed in, okay? And an implant is really kind of like a hollow screw that has parts that can come on and off of it so that you can eventually put a tooth on it, right? So there is a cell called the osteoclast and another cell called the osteoblast. All right? The osteoclast, basically what they do is they take all of that now disrupted bone particles from when the implant was going in and it chews it up kind of like Pac-Man, right? And then once that part happens, then the osteoblast comes behind it and it lays down new bone growth in the grooves of the implant in order to make the implant stabilize and stronger than when it was first placed, all right? So that activity has to happen. In order for that activity to happen at the highest level, number one thing, you gotta be hydrated, right? So in order to make sure that you know your exact amount of hydration, basically take your weight from right now, divide it by 2, and you wanna drink that much water in ounces on a daily basis. That can be difficult to do. I know that is hard for me to do sometimes also, but you literally have to make a plan for it. Your hydration is going to be incredibly helpful in order for so many things to happen in your body, but specifically related to just getting the implant is going to help those osteoclasts and the osteoblasts to get to the implant area and keep drawing the materials that it needs in order to build bone in your area. So hydration is key. Remember, half of your body weight in ounces, you gotta drink it every day, all right? Now, in order to get the water into your systems in an even more efficient way, you really could add some salt to it. Sea salt, Himalayan sea salt, and Celtic sea salt, which is really the best. Sea salt, basically, when you add just a pinch to your water and stir it up there, it really just helps the cells accept the water because the salt gets sucked into the cells and the water follows, and it just helps with your hydration. You don't have to be getting an implant just to be doing this. You could do this with every glass of water, but it does help hydrate you. all right? And hydration is your number one. As a matter of fact, I consider that hydration is part of the food area, all right? So, knowing your blood type, drinking your water, and now we're moving on to proper rest. Proper rest is going to absolutely help your body get used to what has to happen when you are unconscious and your subconscious is working. Couple things in order to get the best rest would be: stop watching television and stop doing busy activities at least an hour and change before you go to sleep. Dim the lights. Tell yourself what time bedtime is so that your subconscious can say, okay, you said 10 o'clock, that's what we're gonna do. Make sure you're keeping the lights low. You could turn on candle lights. You could light a candle and get ready to go to bed. You wanna get between 6 and 8 hours of sleep the days before your implant procedure, because once you get your implant, you wanna actually continue that, and you doing your sleep regime or using your sleep hygiene before you get the implant, it'll make it even better for you after the implant, okay? Oh, here's another one, guys, okay? Exercise. Exercise is crucial for your immune system, which you want to make sure is strong, absolutely strong, certainly before the implant procedure and after the implant procedure. And some people say they don't have time for the gym, and that's fine, okay? But all we gotta do is some jumping jacks. Do jumping jacks for 1 minute. 1 minute of jumping jacks is gonna get your heart rate up, is gonna get some things going. There's something called jump squats. You could do your jump squats for 1 more minute. This is all cardio exercise. You can do push-ups, sit-ups. You do not need a gym. But if you're part of a gym and you have access to weights, using the weights in the gym, finding any routine on YouTube or anywhere, just as long as you are moving your body, letting your muscles feel some resistance, is going to help fortify your immune system, which you're going to need in order to have a great recovery from your implant. All right? All right, so here's another one, guys. You got to make sure that you're detoxifying. All right? So if you're doing your exercise and you're starting to sweat, that's a great part of detoxification. If you have a chance to access a sauna, that is great detoxification for you. You want to stay in there for 20 minutes or so. Get a good sweat. Guys, bowel movements, moving your bowels, getting the thick toxins out of your body is going to help you do what you need to do, because your body needs to get rid of toxins. Toxins come on us all the time, all right? Using our cell phones, eating processed food, eating food that we think is good for us, but it had something in it. Going to your favorite restaurant and eating your favorite meal, more than likely it's got something in it that your body's gonna need to detoxify out, okay? So getting a proper detoxification program, you could do it also by way of intermittent fasting. Basically, you're gonna take some time off. You're gonna maybe just skip breakfast and start eating lunch. Some people have said, eat breakfast, right? Wake up, eat breakfast, but stop eating earlier on in the day so you can have the hours and hours, maybe 14 to 16 hours before you eat breakfast and maybe your lunch, dinner. There's another kind of way of eating which is called OMAD, 1 meal a day. Make sure that that one meal is fortified with all of the right nutrients and sustenance that your body needs. Of course, I say knowing what your blood type is going to be very helpful for you, but eating the Mediterranean diet goes across the board for most blood types, right? But I still say knowing what your blood type is so good for you. So if you don't know, find out what your blood type is. As a matter of fact, there are home blood type testing kits that you can take very easy. I know that I have them in the video description of this video and all of my other videos below. Very, very easy to get. You get it, you follow the instructions, and you can find out what your blood type is yourself. It's very, very easy. And if you want to know where I get this information from, I get it from a book called Eat Right for Your Type, which is written by this great doctor named Dr. Peter D'Adamo. And Dr. D'Adamo actually has continued his work from James D'Adamo, and they have come up with this by way of their data to show that these things work. I have a video that has talked about the O blood type diet. The reason why that video is probably so massive now is because most people in the world are O blood types. I would say that it's the original blood type, and that all the other blood types are derived from that. But that information, all my information as I speak about blood types, is derived from the one book, Eat Right for Your Type, which has not changed one bit since it's been written, as opposed to other books that have been written and changed because new information has come out. Even if the blood type diet isn't something that you agree with, or you've seen something online that says it doesn't mean anything, okay? Or they said that it's not real, or your doctor said it's not necessary. Have you ever asked your doctor for your blood type? Please check, and I'm talking about the American citizens. Ask your doctor for your blood type. Don't say that you watched this video from a dentist. No, don't say that. Just say, hey doctor, what's my blood type? And can you find out what my blood type is, all right? Please note the answer that they give. If they don't give you an immediate, oh yes, you are whatever blood type you are, or oh, we're gonna have to test for that, and we'll do that immediately. If they say anything other than that, please note that and put the answer in the description of this video below, or on any of my videos of blood type, okay? Tell me what your doctor said. I have heard the darndest things from my patients when they asked for their blood type from their medical doctor. I've heard the darndest things. So I'm saying, why are they saying the darndest things? But I'm not gonna share what they say. Please, you tell me. This is an interactive community that we have going on, and I only want the best for you, all right? Guys, the last thing that you can think about, do for yourself days and days before you get your implant, is have a very strong mindfulness practice, okay? And what does that include? Well, having a good attitude. Saying, I'm gonna get this implant and it's gonna go great. That'll work. That's a good idea, right? Here's one that you might not have thought of, okay? This is mindfulness behavior. Be kind to someone that you don't know for no reason at all. Go out of your way and be nice. Do you know that we are all community? We are all together here. And when you treat someone kind for no reason, for no reason except for you just do it, okay? I promise you, karma and dharma will work in your favor. It is beautiful for you to let someone merge into traffic, okay? To help somebody across the street, to maybe pay for something for someone for no reason. Get someone's coffee if you're in a coffee line. Do something for no reason. These things, these little things are going to be so helpful for you. And although it may seem out of order, like, why does this have anything to do with me getting an implant? It's that the feeling that you get having done something nice for someone is going to help your dopamine rise and give you better pleasure feelings. And these better pleasure feelings will be more susceptible and more able to receive more gifts from the universe. It is what it is, all right? Saying things like this implant's gonna go great, that's an affirmation. Learning how to meditate. And I have many videos on how to meditate. Meditation is something that can absolutely help you. It can extend your life, and it can make it so that implant procedure goes well. These are the things that you can do for yourself in order to get yourself ready to get an implant. As a matter of fact, these are the things that you can do for yourself just to live a great life, all right? So anyway, take these words to heart, my friend. These are the things that I practice myself. These are the things that I have seen when people actually take on these behaviors, they thrive. They just thrive. I've seen it time and time again as I serve the public day in and day out. That's all I want to say about that, guys. All right? Please like and subscribe. Please send this video to a friend that's about to get an implant. Please share this with your loved ones for any reason, or any of my other videos, okay? I'd like to thank all of my subscribers that have been joining the community and subscribing to this channel, looking to optimize their health. We're here for you. We love you. Thank you so much. We'll talk about a couple other little things a little bit later.